and that's Howie Hawkins, who was the Green Party candidate for governor. And do you swear or affirm the testimony you're about to give is true?
I do.
Okay.
Well, as a Green Party candidate for governor, I did advocate for single payer because it's universal, comprehensive coverage, no restrictions on providers, free choice of provider. It's progressively financed, and it's by far the most cost-efficient healthcare policy. It would save us money. And I can tell you, I'm going to testify to my experiences as a business owner, worker, and patient, but I want to tell you as a candidate, when I made fundraising calls, the thing that struck me the most, at least a dozen times, I'd call people, and I call in the evening, I'm calling working people, I don't have a lot of big funders, and they would tell me these stories. Somebody in the family got sick, and they're broke, they're going bankrupt, they can't get $5. And, you know, I ran into that so much, it just underscored the importance of this issue. Now, from a business owner's perspective, I'm on the board of directors of a food co-op in our USDA certified food desert on the south side of Syracuse. And when we hired employees last fall, I was involved in a committee to try to get them a health benefit package. And we sat down with the insurance agent and went through page after page after page of options. And, you know, finally, you know, it was very complicated. We said, give us the best high deductible, low premium, high deductible plans we can offer to employees, and they did too. And then none of the employees wanted it because, and I don't blame them, the insurance wasn't worth the money that they would be spending. And, you know, they want to take their chances, you're not uninsured. Some of them could qualify for Medicaid, but, you know, it was very discouraging and a hell of a lot of work. It's a headache, you know, for a business, as other people have said. Now, as a worker, I have comprehensive insurance through the UPS New York State Teamsters plan. And they throw in $8.52 and 7/10 cents an hour. Let's call it $8.53. But our health care benefit is threatened by the Affordable Care Act because what New York Health would provide is considered a Cadillac plan under the Affordable Care Act. So as an individual, a single person, they're putting in for a full-time at $8.53 an hour, $17,742 a year. All the money that they would spend on our health care benefit, over $10,200 a year, will be taxed at 40% starting in 2018. That's over $3,000 a year. Our contract expires in 2018. And you know UPS is going to say, we can't pay this $3,000 all by ourselves. You're going to have to contribute more, or you're going to have less coverage. Now, in my case, I will be able to decide on the Medicare. But that's not looking so good either. Medicare's coverage is limited, the premiums are going up, they're out-of-pocket expenses. It would be a step up in out-of-pocket expenses for me. So as I look ahead as a working person, all I can see is increasing costs and diminished coverage, whether I keep working for UPS or I retire and sign up for Medicare. So I want to see this New York Health Bill act just so I can get good coverage. Finally, as a patient, I developed an inguinal hernia this year, which is a common thing for men. It's one of the most common surgeries to get repaired. It's common for people to do physical labor as I do. And I go through the Community Health Center in Syracuse, and this raises another issue. I call out to suburban health providers, and when they find out my address, they say they're not taking more patients. And so Community Health Center provides good care, but it doesn't have the same resources. So I had to wait a month for a surgeon to come to the Community Health Center, and I'm risking, you know, the hernia's getting worse, and I'm risking incarceration, infection, and something really serious. And then the surgeon came, took 2 months to get the operation, a month of recovery. So I was on half-pay disability for 4 months between the time when, well, 3 months, and it took me a month to get the surgery. And I know under a single payer plan, we would have a more equitable allocation of healthcare planning and budgeting among communities. And that's a big issue for a lot of communities, not just inner city, but we just heard about Lewis County and rural areas. So as a worker, as a business owner, or it's a co-op, so you know, my $100 share, but I'm on the business management side of that. And as a patient, you know, that's why I want to see single payer health care. Health care should not be a buy or die commodity. It should be a human right paid for by a single payer public insurance program, more efficiently at cost for public benefit, and not for private profit. And I believe this bill basically does provide health care as a right. I do have a couple of suggestions for your consideration in terms of its administrative structure. That might provide more democratic accountability and responsiveness and legitimacy for the reasons that Dr. Root was just talking about, some of the suspicions people have of big government. We have regional differences in the state. A lot of people perceive things coming from Albany as coming from New York City special interests, New York City politicians. And this administrative structure was proposed for the National Health Service bill that Ron Dellums introduced based on work done by the Medical Committee for Human Rights. This was like the volunteer medical service for the civil rights and anti-war movements in the 1960s. And Len Rodberg at Queens College largely drafted it. It was introduced by Congressman Dellums and later introduced by Representative Barbara Lee. And what it did was provide for the election of local boards, which in turn elected a state board and a national board. In a state system, you could have local boards and a state system. Now, this is for a publicly financed health service where health provision is public as well as the insurance, like the United Kingdom or Hong Kong, Spain, and other countries have. But it would be relevant for a single-payer insurance system like is proposed here, and I think it would have two advantages. The level of budgeting and administration would be closer to the people. So people in Lewis County that Dr. Root was testifying to wouldn't see it as coming from somewhere else and feel it was their system more. And it would be more responsive to their particular needs. And it might overcome this upstate, downstate, and other regional differences we have. It would create more trust. And then the election of board members would engage the public and providers in the policy and budget decisions. The structure, as I recall from the National Health Service bill, was 2/3 was elected by the public, 1/3 by the healthcare providers, so that they were both at the table on these boards. And I think also the Healthcare Act, New York Health Act proposes that the governor appoint the whole board. And if you distribute the power and regulation, it's harder for special interests and powerful interests to capture one governor and one board. If you have a lot of boards that are directly accountable to the people and coordinate from the bottom up. So that I just offer for your consideration, but I thank you for holding these public hearings, and I hope to build momentum toward the passage of this bill and that you will vote on this in 2015.
Thank you very much. We talked last night about the regional concepts, and we're certainly going to be looking into how we might incorporate that. Questions? Okay, thank you very much.
Thank you.
Ask your question.
And you swear or affirm that the testimony you're about to give is true?
I do.
Okay.
As you said, I'm the former chair of the county legislature. I spent 15 years on the Tompkins County legislature, 6 of them as chair. After that, I was appointed by the governor to be the regional director of state parks for the Finger Lakes. And since then, and I was there for 5 years, and then I retired. And I want to speak to you today from my experience in all 3 of those roles. And I want to focus particularly on hidden costs of the current healthcare system, things that we don't think of as healthcare costs, but that would disappear if we had a single-payer system. As an elected county leader, I found that a tremendous amount of my time and my budget was devoted to one or another aspect of healthcare for some segment of our citizens. Nearly all of that time was devoted not to the actual delivery of healthcare to anybody, but to sorting out who's going to pay for it. Not me, hopefully. And that really, it was about fighting with various different people over who's going to pay for health care. One of the big advantages of a single-payer system is that it eliminates that fight. It resolves the issue once and for all and offers substantial savings in administrative costs and elsewhere in the economy. I've seen estimates that the public insurance programs such as Medicare and VA have administrative costs that are from 10% to 25% lower than private insurance. But every estimate I've seen overlooks a myriad of hidden costs associated with our current system. And I'd like to point out just a few of those costs that I encountered every day in county and state government. My county, like every county, has an office for the aged. We had a 10-person staff, and the largest part of their work consisted of helping seniors to navigate the healthcare system, find the programs that are available to help them, and plan how they'll manage healthcare costs now and in the future. That's a 10-person staff that's not part of the healthcare system. In our personnel department, we had a full-time benefits manager who was mostly occupied with assisting employees in dealing with health insurance programs. Those employees also lose productive work time every time they go in to consult with the benefits manager, and in fighting insurance company denials, which can take hours out of the workday. When we negotiated with our employees' unions, healthcare was always the biggest topic. We had a healthcare consultant on a retainer to help us examine and cost out plan changes presented to our union in an attempt to control costs. At least 2/3 of the staff time devoted to collective bargaining was spent on healthcare issues. We devoted hundreds of hours of staff time to developing and publicizing a discount prescription drug program available to all county residents, just so that those without insurance could get the same discount that's routinely given to all insurance companies. We had a $400,000 grant from New York State to form a health insurance consortium among local governments, county, towns, villages, city, to buy health insurance together. Again, hundreds of thousands of hours, hundreds, perhaps thousands, of staff hours were devoted to this project by both county staff and the involved municipalities. This grant from the state was not a healthcare grant. This was a government consolidation grant. But what we were consolidating was our purchase of health insurance. If we'd had single payer, we wouldn't have been doing it. We hired a consultant to help us through the process of forming that consortium and then finding a suitable plan to purchase. We had staff in our mental health department, public health department, and Department of Social Services devoted to collecting fees from the private insurers of all of their clients in order to reduce the public cost of the programs that deliver the various healthcare services. Again, who's gonna pay? Not me. Let's make the other guy pay. And both of us hire people to fight that fight. We had people waiting in jail that needed to go into drug treatment programs, and the judges were willing to send them there, but the drug treatment programs wouldn't take them until they knew they'd get paid. And they didn't know they would get paid because these are mostly poor people, but when you're in jail, your Medicaid case is closed. Because you don't need Medicaid in jail, and so you're not on Medicaid, so the drug programs don't take people if they're not on Medicaid. And we had staff in the Department of Social Services, and also in a private agency that was government funded, who spent a lot of time trying to get special exemptions to, if not get somebody on Medicaid while they're still in jail, get some kind of a promise that they will be on Medicaid, so that the drug treatment program would take them so that we could take them out of our jail and send them for the treatment they needed. Meantime, they sat in jail and we paid the cost of incarceration. Our economic development program encountered aspiring entrepreneurs who would like to start their own business, but were tied to their current job by health insurance. They couldn't afford to leave their job and do a startup business because they couldn't afford to be without insurance. And then the young businesses that did get started often had trouble attracting the employees they needed because they didn't yet have the ability to offer a health insurance plan. You don't usually look at the failure of a startup business as a health insurance cost, but in many cases, that's exactly what it was. we had staff people who didn't like their jobs and didn't perform them that well and really ought to go and wanted to go. But they had to stay because they needed the health insurance. And so they did stay, and they mostly did a lousy job. When I moved to state government, I again had a staff person in my regional office who was mainly occupied with administering the health insurance plan and helping the employees to navigate that system. She was backed up by a number of people at Albany who she consulted with regularly, who were also on the state payroll to help employees navigate the health insurance system. And again, union negotiations focused heavily on healthcare issues, and when those negotiations are going on, whether at the state or the county level, we're paying the salaries of our own negotiators and the union negotiators who are government employees. Not that, I mean, usually the union hires a negotiator as well, but there are employees on the negotiating team. We're paying the salaries of both sides. As I prepared to retire from state service, I attended an all-day state-funded retirement seminar designed to educate employees about the various aspects of the retirement system. About half the time was devoted to who qualifies to keep their health insurance after they retire, and how it will get paid for, and what kind of credits you can get, and who can cash in their accumulated sick time for reduced premiums, and how it works together with Medicare. That was the more confusing part of the seminar. Unfortunately, I wasn't one of those who was eligible to keep my insurance. So I had to go out to the health plan marketplace under the Affordable Care Act and buy my own insurance. Now, I think I'm a reasonably bright guy, and when the governor appointed me, he seemed to think so too. And I have my own car insurance, and I buy my own homeowner's insurance, and I figured I could probably buy my own health care insurance too. But that seemed okay until I came across the part on the website where the $2,000 deductible plan has a $4,000 deductible. And that's when I decided I have to go consult one of these healthcare navigators who are supposed to help you get through the system. Who pays for those navigators anyway? So this is just
the state does.
This is just a partial list of the many ways the government and local economies spend both time and money dealing with the question of who will pay for health care. Many of those costs are just as real for private employers as they are for government ones. And none of these costs ever get included when people are doing comparisons of private health care or private insurance versus the public system. But every one of them would go away if we had a single-payer healthcare system.
Thank you. I think your testimony is really valuable because while many people are familiar with the craziness of the system in the business world, I think most people are not familiar with all of the ramifications of it in government, particularly local government, and the costs that imposes on local government taxpayers, number one. And number two, for those who may not be as familiar with what it's like to try to run a business, I think seeing what the craziness is in a local government helps to understand what it must be if you're in the business world similarly. So
much of what I talked about applies to every employer, government or private.
Yeah. Thank you.
Questions?
Thank you.
Hi, I'm Peggy Chase. I'm a registered nurse. I'm also a county legislator for the County of Onondaga. I've been a nurse for over 40 years and have practiced in many different settings, hospitals, public health things. I have also recently been doing teaching with RN students that are getting their bachelor's degrees. Part of my practice also has involved doing volunteer work at a free clinic. And even though I'd been in the hospital and seen a lot of people that ended up coming in with issues that were much greater than they should have been if they had been taken care of, but they didn't have insurance, so now it has gone from something of being that could have been something minor to something that has been a crisis. One of the things with doing the free clinics is that, we find out how easy it is to access care when you're not all involved in the insurance world. Having a single payer insurance would make it so much easier for everyone to have access, and we wouldn't be ending up with crisis management rather than preventive care, and more people would definitely feel better about getting care rather than feeling that like there's a drain on the system. So that we are, as a nurse and as a patient, I am very supportive of having a single payer program.
Okay, I took them from her already. Okay. I'm Diane Dwyer. I live in Camillus, New York. I'm a nurse. I'm a veteran. I retired from the Army Nurse Corps as a lieutenant colonel. I served on active duty for 6 years and in the reserves for 18. I truly believe that I worked in one of the only single-payer healthcare systems in the country back in the 70s, and I have supported it since then. My area of expertise has been in public health, and one of the things that concerns me is because most of our healthcare systems, our insurance does not cover prevention. And if we really implemented primary prevention, we would reduce a lot of our costs and prevent a lot of chronic disease. One of the things that I have seen over time in Syracuse is the infant mortality problem. One of the things is that we've seen the high infant mortality go up and down and up and down. The rates go down and they pull out the primary prevention because they don't understand what prevention is about. The single-payer insurance would provide the care so that we would have an ongoing system to make sure that we take care of people, pregnant women, take care of family planning, and we need to have ongoing care. Thank you.
Hi, thanks for asking me to talk for a minute. I'm Dr. Robert Ostrander from the rural Finger Lakes, and I have a small family practice with 2 other family doctors, and I'm also the vice president of the New York State Academy of Family Physicians. I'm here today to support the Assemblyman Gottfried's bill for a single-payer system in New York. The Family Practice Academy has been advocating for a single-payer system for several years now, and it's nice to see it finally getting some momentum. Personally, for me as a doctor and a patient, the most important thing a single-payer system will do is simplify things so that medical care can be about medical care and not about administrative processes and how things are going to be paid. It'll put the doctor-patient relationship back in the center, and the patient's wellness and disease management back in the place that it belongs.
I'm Michael Axe. I'm a physician. I do occupational medicine, and I'm in the Department of Family Medicine at SUNY Upstate Medical University, and I've been doing this for about the last 26 years. But ever since I went to medical school, I've thought that single-payer healthcare was the way to go in terms of transforming our healthcare system. And I've never understood why it is that other people don't just sort of accept the obviousness of why this is the I think, rational system that we ought to have, because I think that from a standpoint of universal care, it's the only system that's been shown worldwide to actually provide universal care from birth to death, to control costs, and to really provide quality care. And so it's not really an experiment that we're talking about here. It's some system that's tried, true, proven. And so that's why I'm here, to give them my opinion about that.
Hello, my name is Jerry Latirzo. I live in Baldwinsville, New York, a suburb of Syracuse. I'm with the Central New York Alliance for Retired Americans, and I'm also a political and social justice activist. I'm here today because forever I believed in single-payer health care. Too many of our Americans are without health care, and we need to ensure that everybody, it is a moral obligation for this country to ensure that all Americans have health care, comprehensive health care, good health care. Everybody's equal. Everybody has the same health care. What brought me here today was I worked with a couple of the Chinese American boys who were without health care for the longest time because they couldn't get it and their parents couldn't afford it until the Affordable Care Act, and we were able to get them some sort of health care. It's not comprehensive, it's not complete, but it's the best thing we can do. But we could even do even better if we had single-payer health care, and that's what I'm really interested in, health care for all, because it's such an important thing.
I'm Dr. Daniel Root. I'm from the North Country, way up north of here, where cows outnumber people 3-1, and there's a lot of wide open space between people. As a result of that, I get to know my patients really well for generations. Grandmas, children, relatives, many of them I've been to their homes, and I've been in practice for the last 24 years. So I think I know my community really well. I'm here today as a family practitioner and also as a small business owner, because my wife and I run this little mom and pop office for the last 24 years, and we just gave it up because we just couldn't afford it anymore. The cost of health insurance for my staff, the number of staff that I had to have to deal with insurance and payments and billing was more than we could stand. Fortunately, the hospital's taken over and runs our practice for us now, so we can continue to work and do what we love, which is to take care of patients, because I got the best patients in the world. I really do. I love taking care of my patients, and I love doing what I'm doing. But I was a medical dinosaur, and you can't make it as a little small town country doc doing it on your own anymore. There are tremendous complexities of the system. Electronic medical records, all the audits you have to do, all of the governmental madness that makes our system harder and harder. And the number of staff that we had to maintain to keep up that process was overwhelming, and we were just going broke. We couldn't do it. So as a small business owner, my heart goes out to those folks who are in any business trying to make a go of it with our healthcare costs, which are out of control. And as a family practice doc, it's really important to me to take care of my patients, to take care of my community. And when I have to deal with uninsured or underinsured people and see the sacrifices that they make to try to take care of themselves, or the pain that they have and the damage that is caused by not getting the care they need, breaks my heart. Because we should be better than that. Our country should be better than that. And if we had any sort of foresight, we would be involved in preventive care and not reactionary care. We'd be out there trying to keep people healthy.
Hi, I'm Nancy Morelli. I'm a farmer, vegetable farmer, using a community-supported agriculture model in Oneida County, New Hartford, New York. And we grow all kinds of vegetables. We do a spring CSA, a summer CSA, and a fall CSA, and we're working on a winter CSA. I've been a farmer for the last 10 years after having a career as a registered dietitian where I really didn't have to worry about health insurance. I did pay in some, but I had a full-time job and my employer contributed. But then I switched to being a business owner, a small business owner, for the past 10 years, and it's been very difficult to get any kind of insurance that's affordable. So I came today tell my story. I had a personal injury last year that really set me back. I had a lot of out-of-pocket costs, and I always have tried to, I obviously have a job that's physical to stay in shape and try to avoid that, but it's not always possible no matter what you try to do to live a healthy lifestyle. So, trying to think what else. When I go to different farmers markets in different towns, when I go around New York State on vacations, and I always like to connect with farmers and hear how things are going, and I always ask, what do you do for health insurance? Thinking that maybe there's some magic plan out there that I haven't heard about and I should know about. And I always get the same two answers. One answer is, I don't have health insurance, I can't afford it. And the other answer is, my husband or my spouse has another full-time job, which he gets insurance and I get insurance through his insurance. So actually one partner of that husband-wife is working two full-time jobs in order so that the other partner can be on the health insurance, which is not sustainable because you can't work that many hours a week and continue with farming. So I will be attending a conference in January where NOFA New York, Northeast Organic Farm Association, is going to be addressing this in a half-day session of how health and care impacts farming and farmers.
My name's Lanika Mabry. I'm actually a resident of Syracuse, a resident of New York State, and I'm also a navigator certified with the New York State of Health. So I've been on the front lines of this healthcare change, and I'm here today because I believe that it's time to take profit out of healthcare and make healthcare not only more affordable but accessible with the single-payer system.
My name is Sandra Gowing. I live here in Syracuse. I'm a retired nurse, and I came here today because healthcare is something I'm kind of passionate about. I believe that everybody has a right to have basic health care, and I know most other countries in the world do this. As someone said today, we're the only developed country that does not give our people basic health care. And not only from my own personal families and friends who have had to make tough choices over paying for health care or paying for other things, have had to go without health care because they didn't have insurance. I just feel for all those people and feel that it's the duty of our country to provide this to all our citizens. And I came here today because I wanted to have my say about this. I wanted to go on record, even though I myself do have, and I so appreciate the fact that I've had health insurance. I have Medicare now, and my husband and I thankfully are able to afford the supplemental insurance to go with it, but so many people don't, and my heart goes out for them, and I wanted to speak on their behalf.
My name is Sarojini Kumar, and I used to be a child psychiatrist, and I worked locally, and I became very frustrated with having to, with the insurance company asking me to discharge my patients before they were ready to. I am a child psychiatrist. I work with youngsters who, when they are suicidal, you need time to find out what it is that you can best help them with. 7 days is not sufficient, and the insurance companies refuse to pay beyond 7 days. So I feel with a single payer that we wouldn't have to worry about who is paying. We can worry about how best we can help the child.
Hi, my name is Melissa Espert. I am currently a first-year medical student here at Upstate, and my friends were telling me a lot about a conference that was going on in the alumni auditorium, and I was interested to know what exactly was about and how different this New York Healthcare Act was different from the Affordable Care Act that's currently in place. And I just basically wanted to become more informed about the differences and why I should support it. And from hearing a lot of the testimonies, it seems like a good petition to be in support of. And after doing my due diligence and more research, I will most likely continue to join this movement.
Hi, my name is Lizzie McIntosh, and I am a third-year student at SUNY Upstate here. I'm a MD, MPH student, and I came here today to show my support for the single-payer bill because I believe that healthcare is a right and that we should guarantee healthcare to every resident of New York State. And I believe that students, most medical students I know, are in support of this system and are in support of universal healthcare. So I wanted to lend my voice and show that the young people in the crowd who don't often come by and who have classes during the day, but that we are also in support of such a system.
Hello, I'm Karen Neslick, a retired speech and language pathologist in Syracuse, New York, and I am on Social Security. And a couple of years ago, I calculated my drug costs. And between my premium for Part D, my co-pays, and my deductible, it exceeded my Social Security. I am advocating for a negotiation for reduced drug prices on this single-payer New York health process. If not, the state is going to be much more in debt trying to run this program. Thank you.
Hi, I'm Tim Joseph. I'm the former chair of the Tompkins County Legislature, and I'm here today because our healthcare system is so absurdly inefficient and focused on preventing people from getting health care rather than ensuring that they do get it. What I spoke about was some of the hidden costs that aren't usually recognized in the current health care system or health insurance system. That is, costs that are about all the different things that we did as an employer and as a government to just help people understand and negotiate the healthcare system, ways that you have one agency trying to get another agency to provide health care while getting a third agency to pay for it, and just all the convoluted in and outs and hoops we go through because our healthcare system is about making money instead of about providing health care.
I'm Dr. William Claypack. I'm the Assistant Chair of the Public Health Commission of the New York State Academy of Family Physicians, and I practice family medicine in Dryden, New York, and Tompkins County. And I came to the public hearing today in order to present and represent the New York State Academy of Family Physicians' point of view on the legislation which would establish universal coverage and a single-payer system in New York State. The Academy has a long history of supporting universal coverage, both on the national and on the state level. We've had that policy since at least 1999. And the New York State Academy of Family Physicians has further endorsed a single-payer concept for the past 10 years. We have, over a long history, worked with the New York State Legislature in advocating for single-payer health care. We have seen this as a benefit to patients as well as to physicians and the healthcare system through a significant reduction in administrative costs, which dollars can be devoted to improving the delivery of services to patients and hopefully improving their health, their longevity, and the years of life that they have in good health. The Academy also has seen the move to a single-payer system and the current legislation, New York Health, as providing for the ability of physicians and other concerned people to collectively bargain with the healthcare system as a forum for airing their views and resolving their difficulties, and also as a mechanism to avoiding bureaucracy, which can be an issue and a problem and raise costs. For example, under the Medicare system, there is no effective way for physicians in the state of New York to collectively negotiate with the Medicare system around such issues as paperwork, around such issues as prior approvals, things that drive up the cost of health care that the usual patient may not realize is doing so. But just as any other cost that gets driven up deprives money for actual delivery of care. So the ability to collectively negotiate, we think, is a very important part of the picture. So we're very proud to be able to support New York Health and to help urge its passage, and we believe that in 2017, when the ability to have a waiver under the Affordable Care Act comes about, that New York will have a single-payer system ready to go.
My name is Linda Hunt, and I'm an Albany resident, and I'm here as a member of the community in support of Dr. Prop's group, which my husband is a member of the steering committee, and in support of Assemblyman Gottfried's bill, and also in support of other community members and various people that I know who are struggling with health care issues. As a former, or now retired state employee, I recognize that we have what would be considered Cadillac insurance, but that the costs are being driven higher exponentially, and services are being rationed, and the system is inefficient. What I know as a person with a disability is that under the current systems, I have had experience in my life of applying for insurance of different kinds and not being sure whether I would get it because of being blind. And we need to have rational and fair single-payer health insurance, because we are an aging society at this point, and because we're all temporarily able-bodied or temporarily able-bodied to some degree. There is no guarantee that we will not need significant medical care in our lifetimes. And so I support efforts that will maximize good quality of life for people and minimize suffering and stress from the financial inability to provide care.
My name is Richard Gottfried. I'm from Connecticut, and I come from a national provider of respiratory and oxygen therapy. And I came here just to understand what the single-payer system is, how it might affect us as providers.
My name is Wilma Rafe. I'm a retired state employee, and I came to this testimony today on the New York Health Plan because I'm interested in the fact that the existing healthcare system does not cover everybody in the same way that we think we ought to be covered, and I wanted to hear the people who are testifying for the health plan and those who are testifying against the Health Care Act in New York State to get a sense of where people are coming from, because I think that even with the Affordable Care Act having been rolled out in the way it's been rolled out in New York State, there's still a number of gaps, a number of issues that people are still having. And if the system that's being proposed under this legislation would eliminate or even minimize, but hopefully eliminate, a number of these problems that people are still having with a system that's supposed to have been fixed. I think that's a wonderful thing. I should have testified, but I didn't get my ducks in order quickly enough, so thank you very much.
Hi, I'm Mark Josefsky. I'm from Kingston, New York, where I practice family medicine and teach medical students and residents. I'm currently president of the New York State Academy of Family Physicians, and we represent 6,000 physicians, students, and resident physicians training in family medicine and practicing family medicine throughout the state. We've had a policy of universal comprehensive health care coverage for almost 20 years, and we have revised that over that time frame to have a strong belief in a single-payer health system. We strongly support Assemblyman Gottfried's proposal for New York Health for the myriad reasons of releasing the issues of administrative burden to help make universal coverage sustainable and available to all New Yorkers for the long term.
Hello, my name's Judy Sheridan Gonzalez. I'm a registered nurse. I work in an emergency room in the Bronx, and I've been a nurse in that emergency room for over 30 years. I'm also president of the New York State Nurses Association. I came here today because I have a moral obligation to speak out for the sake of my patients and my community and the profession of nursing. The current healthcare system is a destroyer. It destroys the profession of nursing, the profession of medicine, and in fact harms patients often more than it helps them. We support, our organization, NISNA, and many of my colleagues support a single-payer system, which would be a rational way of providing health care for everyone, and in the long run would be far less costly than the system that we have right now.
I'm Sarah Nicoli. I'm the supervisor in the town of Palatine, New York. We're a small town out in Montgomery County, very rural, low income since the loss of manufacturing and growth of agricultural industry. And my residents really have a very difficult time coming up with the money they need to pay the healthcare premiums associated with the Affordable Care Act. And yet we also know that health insurance is necessary. A lot of our residents are literally paying their health bills through spaghetti dinners and church fundraisers. You know, these high deductible plans really leave families struggling. The potential to save 20 to 30% in healthcare costs is just extraordinary, and so I am urging the New York State Legislature to pass the New York State Health Bill and single payer for all.
My name is Bev Alvis, and I live in the town of Ephrata in rural Fulton County, New York. Healthcare is a human right because it's something that every single person will have to experience at some time in their life, the need for healthcare. It's part of the nature of being a human being. And I wanted to ensure that we get the best health care we can get in New York State until we get a national bill that would ensure every person has equality health care. I say that it's a good thing to make a living working with sick and disabled people. It's not okay to make a profit from their suffering, and that's what private insurance companies do. Thank you.
My name is Bob Bradley. I'm from Warrensburg, which is in the Adirondack Park, and I came to Albany today to testify about a family personal situation involving medical care that concerns me deeply. Both my children have type 1 diabetes. They've had it for 22 years, and for the majority of that time they were covered under my health insurance plan. The costs were the co-payments I paid, but the major costs were covered by insurance. My children now are out on their own. They have jobs. They have regular lives like most people do, but what they don't have, in my son's case anyway, is good health insurance. His employer has a very basic plan. The premiums that my son pays are quite high, and the co-payments are high. And this has resulted in him not being able to afford to go to the doctor for his chronic illness. Type 1 diabetes is an illness that lasts a person's entire life, and it needs to be managed very carefully. And if it isn't, there are numerous side effects, vision damage, nerve damage, permanent damage that are even costlier to treat and care for than the initial care would be if it was done properly. So I'm here today to raise that awareness with the legislators and to make them realize that in our current system, 30 cents out of every dollar is not used for medical care. It is for the insurance companies. It's for profit, it's for administration. Corporations in the US make a profit, and that's a good thing. Corporations have no place in medical care. No profit should be made at the expense of people's health.
Yeah, hi, my name is Rich. I'm a registered nurse. I work at Vassar Brothers Medical Center. I'm a member of the NYSA, New York State Nurses Association, and I came here at their recommendation and invitation today. But more importantly, I came because I see what happens at the person level in a hospital when there's pressure for profit. I see patients waiting for their pain medications. I see patients waiting in hallways. I see patients waiting in urine and stool, all because there's not enough staff. The reason that there's not enough staff is because the CEOs of our hospitals and our hospital chains are striving for profit. All the problems that the patients are suffering at the hospital level are eliminated by having adequate staffing. So I'm an advocate for safe staffing, which of course is in some ways associated with single-payer health care. In addition to that, I see patients getting medications in the hospital paying $100 to $200 for an inhaler for asthma that in a place like France that does have single payer costs $10, $5, $10, $15. The same medication, the same manufacturer. The only difference is here there's a number of level of people that need to make profit on that inhaler. Single payer would eliminate that as well. So single payer along with safe staffing are two real solutions to healthcare problems that we have in America, and that's the reason that I'm here today.
I'm Matt Funicello, and I'm here from Moreau, New York, which is just near Saratoga Springs. And I am an owner of a bread bakery in upstate New York. We employ 30 people. And I am also a previous congressional candidate and probably a future one with the Green Party in 2014 and 2016. And I'm also someone who spent time living in Canada under a single-payer system. Longtime activist for single-payer. And longtime recognizer of the truth that it is the only system being employed by almost every industrialized nation for good reason. And we certainly could follow an example instead of pretending that our very awkward leading so far is actually turning out to be an efficient system for us.
Hello, my name is Derek Roberts, and I live in Dutchess County, New York, New York, and I lived in Poughkeepsie for about 57 years, and the reason I'm here is because I used to work at Wasatch Developmental Center, which I started in November the 25th, 1980. I retired from Wasatch. It's now what's called Dutchess Human Israel DDSO, and in the year of May of 2012. And then because I know the situation with single payer, and I approve of it because of the injuries I had suffered as working as a developmental disability A, and I'm very fortunate, even despite the fact I had injuries to my back and to the shoulders through the spasm I suffered through pain, is because I have health insurance. I know that many people who are not in the health field or who are in the low income health field don't have that fortunate issue to have health insurance, and everybody if you're in the health field or not, need single payer, because if we don't, people does get injured, people does have health, and it's a choice between feeding your family, paying your bill, or medical care. Is a really tragic way to live. We need single payer because everybody is not as fortunate as me to have health insurance or be able to cover the high premium and deductions they need to protect their families. So I'm all for single payer, and I hope New York really appreciate the people who work in the health field or construction or any of the activities that we need to protect our people. Maybe single payer is the way to go. If not, you will see a lot more people suffer without the benefits that they can enjoy from single payer. Thank you very so much for your patience.
My name is David Curry, and I came here today to testify on behalf of United University Professions, which is the faculty union of SUNY Plattsburgh. I'm a practicing nurse practitioner from Plattsburgh, New York, and have taught nursing for many, many years. My experiences both with the union and with in the healthcare system have convinced me that the only way to go forward is a single payer system. We cannot continue to have 20% or more of every healthcare dollar lost to administrative fees or profit.
Hello, my name is Jane Bowder, and I showed up at this today because my alternative friends also showed up, and I had a free ride, and I got very much into it, and I've always espoused single payer. It seems like the easiest, sanest way to replace our dysfunctional system, the for-profit system, with something that would cost us all a lot less money and a lot less complications. And that's about it. I don't know if I said it, but I'm from Glens Falls, New York.
I'm Darius Shonfar. I am the city treasurer in Albany, New York. I came today to testify basically based on my position as a city treasurer, and to talk about how single-payer health care will affect property taxpayers in the city of Albany. And what I certainly concluded was both astonishing in some ways and yet very unsurprising in others, and that is that essentially single-payer health care, either the ACA at the national level or single-payer health care at the New York State level, would save our property taxpayers in the city of Albany at least 28% of our property tax bills. That's a significant sum of money and would save thousands of dollars to an average homeowner. And I think that while I certainly believe that single-payer health care is the moral thing to do for citizens of America and New York State, I think the financial implications of single-payer health care are really staggeringly beneficial to the ordinary taxpayer. There are millions of dollars at the local level. There are millions of dollars at the local level that we expend on healthcare that are essentially a hidden healthcare tax on property taxpayers, and it's an enormous sum of money that could be saved if we had single-payer healthcare.
Hi, my name is Maria Alvarez, and I'm the Executive Director of New York Statewide Senior Action Council. And I came to this hearing today to speak on behalf of all seniors and families in New York State on the importance of a single-payer health benefit and payer bill. Out-of-pocket costs for seniors and for their families for health care are skyrocketing. People are not able to make ends meet. Sometimes they choose between paying their health bill, buying prescription drugs, paying their rent, or food. So with a single health payer bill, we would have equal access to health care for everybody, no matter who you are around the state, and it would be a lot more cost effective. The services would definitely be better, and we would be able to have a much healthier New York.
So I'm Daniel Platt, P-L-A-A-T. I'm from here in Albany, New York. I'm 27, and I'm coming out of the Occupy movement, general left of left. We're just simply left politics, but also libertarian as well.
So why did you come today?
I came here to represent a younger voice. You don't see too many students showing up to these kind of things, or certainly we can hold our own rallies and stuff, but otherwise this level, the hearings process is very foreign, and it's not something that's encouraged unless maybe it's part of an internship. But otherwise, that's a tangent. I'm under 30, and everyone I know under 30 has healthcare as a concern when it comes to some kind of coverage. It's kind of writing us off to think we don't care about our health or that we don't want health coverage because we know emergencies can happen. And employment doesn't really want to supply it anymore, and neither should it, especially if we want to make our own employment, which is pretty much how we'll survive going forward. Any job growth that happens is extremely low. Our prospects are very dim. If we want to put our education to use, if we have one, even if we don't have one, if we want to put ourselves to use, we need to be able to work for ourselves, and that means having a healthcare safety net that applies to everyone universally. So it's something we do not have to worry about. If we have a job, we can pay enroll taxes, and it can be one system that is simply there.
Well, my name is Justin Pigueros. I'm a second-year medical student here at Albany, and I'm here supporting the New York Health Bill because I am a single-payer supporter. I'm, more than anything, a universal care supporter, and I really do see this as the most feasible way to achieve that. Going into the profession I want to go to, I want to be able to provide for my patients, my future patients, in the way that I think is best, in the way that they think is best too. And in a lot of ways in this country and in this state, we can't quite do that yet. So I know it's a dramatic piece of legislation, but it's important. We need dramatic change, and I think in our healthcare system. I don't think it's a very outlandish opinion to think that everyone is deserving of some sort of healthcare, some basic form of access to care, not just access to coverage, but access to care, which is they're completely different markets, they're completely different things, and it's not new. The idea of universal care. In fact, I'd argue that most Americans are in favor of universal care. We passed it with EMTALA, the Emergency Medicine Treatment and Labor Act, which is that if you are in some sort of emergent need of care, that you are at least have the right to emergent treatment, to stabilization, if not curative care. That's a form of health care, and it is a right in this country. So I feel like the principle is there, but we're still trying to argue with ourselves over how we want to go about doing that. And I think when push comes to shove, it takes a while for us to get there, but we're going to get to the point where we realize this is the most important way, the most feasible way for us to achieve that type of universal care that we want, that we do need a single payer plan, and that can look 100 different ways. It's not just a one-size-fits-all type of plan, but we need to keep pushing this type of legislature forward. And as someone in the healthcare field and going into the healthcare field, it's important that I do my part and uphold the oath that I took to my patients and my future patients. And that's why I'm here.
Hi, my name is Claudia Calhoun. I live in Inwood in northern Manhattan, and I work with the New York Immigration Coalition. And I came today to testify on behalf of the immigrant communities in our health collaborative on why universal health access is important and is going to be good for immigrant communities, all immigrant communities, including the undocumented, so that they can take advantage of programs and get access to health care.
Hi, my name is Alyssa Colton. I am Chief Shop Steward for SEIU Local 200 Adjunct Action, the College of St. Rose in Albany, and I'm an adjunct professor of English at the College of St. Rose in Albany. And for many years, I have been working in part-time or temporary positions and have really been forced to scramble for work in order to basically provide health insurance for my family. My husband was self-employed for a long time, recently had to close his business, and in the process of that, he had to go to the hospital for congestive heart failure without health insurance. So we were left with a lot of debt, now facing bankruptcy, having to sell our house, having 2 children, and relying on welfare while I'm working 2 part-time jobs. Even though one of my employers offers health insurance, it's too expensive for me to buy it. It would cost about the equivalent to what I make from that employer in order to purchase the health insurance. We are now eligible for Medicaid, but even with that, it's quite a lengthy process, having to apply, having to prove my income, having to explain my income, having to fax documents, all those kinds of things that I can't imagine somebody with even less resources having to deal with. So when I was asked by our union organizer to come to this, I jumped at the chance because for a long time it's been an issue that's been really, really important to me. I do understand the situation of employers. My husband was an employer himself, and I just don't think employers should have to be responsible for people's health insurance and health care. I think it should be totally separate. I don't think that we should be having to take jobs just so that we can get health insurance. Another issue is that many adjuncts are looking for full-time positions and can't find them. This is a reflection of larger forces at work. More and more companies, nonprofits, higher education, they're relying on part-time, temporary workers, and they're purposely not giving these people enough hours so they don't have to pay for health insurance. So that puts many of us in a really precarious situation. We're either scrambling from year to year to find health insurance, or just going without. So it's a really difficult position to be in. We're people who have been educated. We've gotten the highest degrees possible. We've incurred debts. Many of us have families. Many of us put all that we can into our work, into our teaching. Yet there are just no jobs available because increasingly they're relying more and more on part-time workers, just like in the corporations, just like in retail and service sectors. So we all have to work together to say that not only do we need fair wages and access to full-time work, but if we could all just know that we have health insurance, or we have health care, that we don't have to worry about when my job ends, what am I going to do? That would just be a huge burden that's lifted from the shoulders of families.
Hi, my name is Colin Fox Thomas. I am with Capital District Against Fracking and a member of the Green Party of New York State. I live in Troy, New York currently, and I came out today to support single-payer healthcare here in New York because there are a lot of hidden ways that New Yorkers are being exposed to fracking waste and the health effects of fracking, even if the drilling isn't necessarily occurring here in New York State. And people should be protected from those associated effects, and especially the cost that can come from some of these illnesses. And it's just a more equitable system. I currently do not have insurance. I've actually never had insurance being employed, except for when I was in college. And I don't think the Affordable Care Act it goes far enough into providing affordable coverage, especially for people like myself who still live pretty deep in poverty, and that affects the amount of care I can get for myself, and I know millions of other New Yorkers are in a similar situation, and that should be rectified.
My name is Kaylee Curran, and I am a small business owner from the village of Greenwich in Washington County, upstate New York. And I came to the hearing today because I wanted to be a voice for small businesses who have a tremendous burden when they take on the responsibility of providing health insurance coverage for their employees. Our current system is primarily based on employers providing coverage, and I think that's an important thing. When that is the primary way for people to get coverage, I feel it's an important thing to do. But it's really hard as a small business owner to do that, and so I think the opportunities that would arise from a single payer system would be tremendous from the perspective of a small business owner. It would allow me to base hiring decisions on whether or not I have work to do, rather than whether or not I can take on additional employees, given the health insurance premiums that come along with employment. I currently pay 80% of the premiums, whether it's for individual or health insurance or individual health insurance coverage for my employees, and that premium is one of the biggest checks that I write all month, and it really puts a damper on what I can do and how much I can grow my business. And I think as an employer who takes that responsibility seriously and wants to be a conscientious employer, it would be a major achievement to have a single payer system that would take that over.